Hello everyone, I'm Dr. Harpreet Sood, GP partner in South East London, and have also recently joined the Access Integrated Medical Advisory Board. I'm super excited by neighbourhood health teams because as I increasingly see my workload in primary care, more and more of it is becoming socially led, but also more around mental health, which then means me using more of my social prescribers, using more of our mental health teams, but also working with colleagues in social services. And this is the essence of what we define as neighbourhood health team, which I know some great work is happening across in the NHS, but we're excited to do more and more in this space for our patients because that's the future of care that we are now starting to see and where the demand is coming from our patients and their families. So how we work with them, how we interact with our social prescribers, health and wellbeing coaches, and working with nutritionists, other healthcare professionals across primary care is really where the opportunity is, but also where we will work together as a neighbourhood health team. One of the things I'm doing today with my healthcare team in my practice is that every other week we have a full morning of home visits where my healthcare assistant, but all the other staff when available, we go and do home visits, frailty visits, but also get to assess the individual in their home environment, which often gives us a really good insight of how they're doing at home, how they're coping, but also the help and services they need, whether it's occupational therapy, physiotherapy, dietary, but also some of the services that might well be provided by social prescribers. And I think the biggest challenge we face today is that there's a plethora of services in the community, but we often don't know what's available, but also how we engage and interact with different parts of the ecosystem, how we send messages or how we communicate. Of course, we use things like email, we might pick up the phone, but we are looking forward to seeing more technology-enabled solutions that are coming through that allow us to interact and build an ecosystem together, which again defines a neighbourhood health team.